Hello, doctors. I'm Dr. Chris Rapoff of EZ QME Continuing Education, and welcome to this week's presentation. Today is the second of a two-part series, the study that was produced by the Workers' Compensation Insurance Rating Bureau of California in 2023, and it provides insight into the healthcare industry in the state of California. Specifically, we're providing a comprehensive overview of the operational characteristics, workers' compensation claims costs, and key cost drivers of the healthcare industry in California. Today we're going to discuss the loss and the payroll experience within this industry sector as we take a further dive into just who and what the drivers are in affecting the cost of healthcare in California. First, these are the following sources I reference when producing this presentation. Feel free to copy and paste these links into your browser if you'd like to read more about the WCIRB and particularly the subject of today's discussion. As a review, we learned last week that the healthcare industry is a significant and a growing part of California's economy and one of the largest sectors in the workers' compensation system. Last time we explored the demographics of the healthcare sector and includes professions such as physicians' practices, dental offices, hospitals, nursing facilities, and home health care. We also discussed how these segments generate 6% of all California workers' compensation insurance premiums. In addition, we learned that the distribution of the healthcare industry employers by annual payroll size is pretty comparable to the statewide averages. And like many other industries, the highest concentration of healthcare industry payroll is in the San Francisco Bay Area and the Los Angeles area basin. Now here we take a look at the historical cap loss to the payroll ratios. And the loss to payroll ratio for the healthcare industry, which is smaller to the statewide average, is really largely driven by the physicians' practices in hospitals, as you can see here. The nursing facilities and home health care segments have the highest loss to payroll ratios, whereas the physicians' practices and dental offices have the lowest loss to payroll ratios among all of the segments. The differences in loss to payroll ratios are mainly driven by the claim frequency, and the different risk exposure is potentially due to different levels of physical aid provided for each segment. Now, as we look at total claim frequency, I want to point out that this is total claim count per $100 million of payroll between the payroll year of 2015 and 2019. And overall, as you see, the healthcare industry has a higher frequency and a lower severity than the statewide average, which is surprising. And nursing facilities have more than 4 times the frequency rate of the physicians' practices. Some of this differential is driven by the lower wages in the nursing facilities segment. Now here we investigate the change in indemnity, or the loss actually, or the costs of the claim frequency per a full-time equivalent. The indemnity claim frequency for the healthcare industry really did decline at a greater than average rate over the last decade. Now for hospitals, the indemnity claim frequency, excluding COVID-19 claims of course, increased in the latest year, while the frequency in other segments continued to drop. They think that this is partially driven by a more significant shift in the claim mix, which would be a medical only relative to indemnity claims or loss claims of hospitals. Now, overall, the healthcare industry has a lower than average claim severity, but is driven by the higher share of medical only claims and the lower share of permanent disability claims. Now, the higher average claim severity for home health care is due to the significantly higher share of indemnity or loss claims. Taking a look here, average home health care claim was $14,872 versus the actual hospitals at $10,446. So there is a substantial difference in the claim severity. First, I apologize for the busyness of this slide, but I wanted to share this information. I felt it was pretty important. And what this is it represents a share of the claims by the injury type. And this is from the payroll year 2015 to 19. And they discovered or discussed medical only, temporary disability only, and permanent disability and death. And as you can see, most of the healthcare segments have a higher than average share of medical only claims and lower average share of permanent disability and death claims. That's pretty obvious. Now, the home health care does have a higher share of indemnity claims as the operations provided in this segment require more physical aid, such as lifting and moving patients, helping with showers, and their personal care. In addition, the dental offices have the largest share of medical-only claims, which drives down the overall severity of the lowest among all of the segments. So now we have a comparison of the indemnity claim frequency by the regions, which were relative to the statewide average for healthcare industry versus statewide in general. As we see, the indemnity claim frequency pattern by region for the healthcare industry is similar to the statewide pattern. After controlling for the classification mix and wage differences, the Los Angeles area continues to have one of the highest claim frequencies, while the Bay Area has the lowest claim frequency. The healthcare industry does have a larger than average differentials in the frequency across different regions. And I also included the Santa Cruz Monterey area as a comparison. As you see, the healthcare industry and statewide in the Santa Cruz and Monterey industry are comparable. As we look at the leading causes of the injury in the healthcare segments, these are all approximations. We see that the dental offices have the highest share of claims involving cut, scrapes, and punctures injuries, likely resulting from the use of the dental instruments. As we see that, it's 42%. Now, in nursing facilities and home health care, they have a higher share of claims involving strains, strike and fall injuries, more than the physician's practices, and that's likely due to the higher physical assistance provided in those segments. That's understandable. As we see the nursing facilities and home health care, over 40% of their claims involve strains and sprains. And now, on the other flip side, the home health care has the largest share of claims involving motor vehicle injuries at 5%. And this is generally due to the care providers often driving the patients to the doctor appointments and performing other driving duties for their patients. Now, as we look at the indemnity claims for cumulative trauma injuries from 2015 to 2019, we do see that the share of the lost claims involving CT injuries for the healthcare industry is pretty similar to statewide averages, around 15%. However, dental offices have a much higher share of CT claims than the other healthcare segments. As we see there, the dental offices are 37%, physicians' practices are only 22%. This may be related to the repetitive movement and the long duration of dental procedures and a lower frequency of non-cumulative trauma claims. So very interesting material here today. It really does illustrate that it isn't surprising, and it shouldn't be surprising, that the healthcare industry in California is such a major driver of the workers' compensation cost over time. Last week we explored the different sectors of the healthcare industry, and this week we concluded the discussion by talking about the loss and the payroll experiences within this California's healthcare industry sector. Hopefully, I hope now that you do have a better understanding of how these losses are distributed within the healthcare sector when it comes to workers' compensation claims in California. So doctors, I'm Dr. Chris Rapoff, and again, I wanted to thank you for taking the time to join me in this presentation. I hope you enjoyed it, and I do look forward to sharing other interesting subjects with you as they relate to the topics involving workers' compensation in the state of California. Until next time, thank you.